it's not just the delivery itself, you know, it's all the prenatal visits. And one of the things that I really focus on is education. Because I really feel like if they're educated, one, they're going to be more empowered, but two, they're going to kind of, you know, of course, everything kind of unfolds different, you know, but kind of know what they're
the Intuitive Pathway podcast. Today we have Silvia Esparza. She is a certified nurse midwife, and so she's going to talk to us about her business and what she does and about all that. So thank you for coming.
Thank you for coming on, Silvia.
Thank you for inviting me.
Yes, I'm glad to have you on. Sylvia's actually a personal friend of mine, and her daughter actually does some babysitting for us too. So really thankful that you decided to come on and tell us about your business.
Well, I'm excited. Thank you guys very much for having me.
Okay, so let's jump on in. So tell us a little bit about yourself and your business, what got you into this.
Okay, so well, I'm a certified nurse midwife. I've been practicing for, I think this is my 7th year now. I am the first certified nurse midwife to return to Amarillo. There was one a few, I don't know how long ago, but it's been a while since we haven't had a certified nurse midwife here. So I decided to become a midwife, I guess it was like during nursing school. So I knew when I was little that I wanted to catch babies. But I thought that it was going to be as a doctor. And then when senioritis hit, I was like, I'm like, I don't even want to finish high school. I don't even know if I'm going to be able to finish med school, you know? So I ended up doing the nursing route, and when I was in my labor and delivery unit, I remembered. I was like, oh, I love this. Like, this is what I want to do.
So you're a nurse too?
Yes, so I'm a nurse. So a certified nurse midwife is an advanced practice nurse that focuses on midwifery. So you have your master's degree in nursing. So that's what I do. But when I did my labor and delivery rotation, it was just amazing. I delivered 3 babies by that time. And
as a nurse?
No, as me. My children, my own children. And it wasn't the same. Like, I was in tears, you know, like I was supporting this mom, and I was just a student, and I was supporting this mom laboring who I just met that morning, and I was like, oh my gosh, this is amazing. This is what I want to do. So from that day forward, I remember when I was doing my orientation in the NICU, my preceptor had asked me, so what are your long-term goals? And I was like, to be a midwife. So that's where I started from right there, and that's how I'm here. So
cool. What did it take for you to get certified in that? Because you were a nurse. You had like your master's degree as a nurse, right? And then what else did you have to do to become a midwife?
So it's a bachelor's degree in nursing, and then you go on to your master's. So it's a nurse midwife. I'm certified because I'm certified through the certifying board, National Board of Midwifery. So it's a certified nurse midwife.
And you said you're the only one in Amarillo that is?
No, so now currently we have 2 other nurse midwives here in Amarillo. One of them does not practice or does not catch babies because unfortunately the hospitals do not allow midwives in the hospital at this time, and she's not comfortable delivering outside of the hospital. And the other one just graduated back in August, and she just started her practice.
And so you've been doing this a while.
Yes, but I was the first one to return, or the first one to come back here to Amarillo. So like when I did all of my clinicals and stuff like that, I had to travel to Houston, El Paso, Dallas, because there's not a midwife here in Amarillo. So I did a lot of travel.
And so how many clients do you have at one time? I mean, that's a lot for like one person to take on.
It is, because we do everything from, day 1 till, 6 weeks postpartum, during the labor itself as well. I'm monitoring mom and baby. I'm laboring with them. So it could be pretty, it's a lot of work. It's not where you just come in at the end, catch a baby, and then walk out, because then you recover them as well. So I only do about 6 a month. But
That's a
is
lot,
still
though.
pretty busy. Yeah, and it's not, like I said, it's not just the delivery itself. You know, it's all the prenatal visits. And one of the things that I really focus on is education. Because I really feel like if they're educated, one, they're going to be more empowered, but two, they're going to kind of, you know, of course, everything kind of unfolds different, you know, but kind of know what to expect, you know.
That's something you mentioned you wish you had more of.
The what?
Right, the education part.
No, for me, well, I don't know if this pertains to all or a lot of women that choose a midwife, but like my oldest I had in the hospital and it wasn't a good experience. And so when I got pregnant with my now 3-year-old, I was like, I'm gonna look into this whole home birth midwife thing just to see. And then I met the midwife that I used, and I was like, okay, this is it. The only thing that I would have liked more of, and this is probably just me and not knowing how it worked, was more guidance as far as like because I'm Rh negative, and so in the hospital with my first, they automatically gave me the RhoGAM shot at however many weeks, and with hospital stuff, you don't worry about any of that. They just tell you where to go and what to do.
Oh yeah.
And so with the midwife, I was kind of more on my own, having to ask, like, do I need to do this again? Do I need to do this again? And so that's really the only part that I didn't even dislike it. I would say that I would have liked a little more help with in the process.
Yeah. Well, unfortunately, it should have been like that.
Okay.
Yeah. So
I thought you were gonna say that's the way it is.
I figured, it was just me not knowing how the process worked. Like, I was responsible for.
Well, I mean,
knowing
there's
those
still
things.
a lot of responsibility on the parents to learn things,
Yeah.
but it doesn't mean that you should be left on your own to do everything,
Mhm.
you know. A lot of times, I guess it's just because there's not a good understanding of what midwifery care is, but midwifery care still is care. It's not like we don't do anything and then just show up when the baby's about to be born and just hope for the best.
Right.
You know, that's not the case.
Yeah, and
You
with
know?
my experience, like, I really loved the fact that she came to my house for all the prenatal visits. It was
Mhm.
very comfortable. And then I remember one time towards the end of my pregnancy, I noticed he hadn't moved all day towards the end of the day, and I was like, well, I'm a little worried. So I called her, and she's like, I'll be there in about 30 minutes to check. I was like, okay. So it was just, I don't know for anybody who has any misconceptions about that, it is very good care. It's not like, and I didn't mean to like say I felt left on my own, because I didn't. I would have just liked maybe a little more guidance as far as like testing that I should get, or
Yeah, that makes sense.
But
and there is,
Yeah.
you know, and it's everybody's gonna be or everybody provides care differently,
right, exactly.
you know. But yeah, like I was saying, like, it's still care, so like all of the testing would still be offered,
Mhm.
you know, and like the prenatal visits and all of that stuff, like all of that is still what you're getting.
Yeah.
The big difference, at least like with my practice, and a lot of midwives too, you know, it is that education, so you can make your informed choices.
Right.
You know, so what might be right for one family is not going to be right for another family. But if you're not educated on what it's for, so like for the RhoGAM, for instance, you know, if you don't know what it's for, what are the risks, what are the benefits of getting it, you know, you might say, oh, okay, I definitely want that, you know, and somebody else might say like, oh, I'm not concerned about that,
Right.
so I don't want it, you know, but it's still really important to get that education so you can make the right choice for your family. So
Okay, and do you have 2 businesses?
So I do. So I have
Okay.
2 businesses because I have my practice, which is Beyond Birth Midwifery. And that's where we do all the prenatal care, the clinic, you know, all of that stuff. And then I actually own a birth center too. So mamas
what's
can
that?
deliver at the facility, a birth center, if they're not comfortable delivering at home.
That's neat.
So,
That is
and
really
that
cool.
one is Birth Haven.
Birthday.
Yes.
Okay, tell people those 2 again, because I'm sure they'll want to
So
know.
Birth Haven is the birth center, so it's the facility, And then Beyond Birth Midwifery is my actual practice.
So you do both? So you have your actual practice and then you just oversee the
Yes.
birth center?
Yes.
Okay.
So my goal was to have the facility available so other midwives can use it as well.
Oh.
Yes.
So how does that work then?
So it's kind of like the hospital, so the hospital is available and then the doctors who have privileges there go and deliver. So the family, the mother still decides, oh, I want to go to this hospital or I want to go to this hospital, and if the doctor has privileges there, then they can deliver at that hospital.
Wow, how did I not know this? I thought you just did like the, you had, I knew you had like a little place, but I didn't know it was to where other midwives could go and help their people.
Well, I mean, because there's not very many other midwives.
Yeah, there's not a whole lot of
So,
room.
Yeah.
So that's the big thing, but that's also one of my goals is to really grow midwifery because it's going to happen. People are realizing what midwifery is, and what out of hospital birth is, and
So
the
what
safety
is
of
it then? What is midwifery?
Midwifery. Okay, so midwifery. Okay, so a midwife is somebody that is trained to be with a laboring mom to deliver babies. So it would be with the prenatal, the delivery itself, and postpartum, and we can even take care of the baby, depending on what kind of midwife you are. So like I said, I'm an advanced practice nurse midwife. I can take care of the baby for 28 days. A licensed midwife and a licensed midwife or a certified practicing midwife, they don't have their nursing degree, or they might have a nursing degree, but they're not master's prepared or doctorates prepared.
Okay.
So it's not that graduate course that they have. Okay?
Oh, okay.
They have a little bit different scope than what I have, so they are able to take care of babies for 6 weeks. One of the things that I could do that they can't do is well women care as well. So like I can be a well women care provider.
Oh,
if I wanted
interesting.
to. Yeah,
Can you like make prescriptions for people?
I could.
Okay.
Yes. So like if somebody has a urinary tract infection, this morning I had somebody call me that they had pink eye, and I can just call in the prescription.
I
for
got
them.
pink eye when I was pregnant. I had pink eye like 20 years. I was like pregnant. I was like, oh wow. So anything goes.
Yeah. And the big difference between midwifery and the regular medical model of care is that in midwifery, or the midwifery model, we see pregnancy as a normal process in a woman's life, not as a disease process, is how it's seen in the medical model.
Okay, explain that more because that's interesting. What do you mean it's like a disease process?
So anything in the medical model is like you're sick.
Something wrong.
There's something wrong. Yes.
Oh.
So even like when you go in and like you're filling out your forms, it says chief complaint,
Yeah.
and it's like pregnancy. I'm like,
Yeah.
Parasite.
There's something feeding off of me.
So that's what they see it. They see it as like you're a sick person. There are certain things that can come up during pregnancy that can, cause you to become what we consider higher risk. So it's not just a normal process anymore, but that's not every woman. And so because we are trained in healthy, low-risk pregnancies, then we really kind of incorporate the care as a whole. So it's not just, you don't just go into the office and, get all these numbers down and then that's it. Like when you go into a prenatal care visit with the midwife, it's a lot longer. So we talk about nutrition, we talk about what's going on,
Wow.
stress, with kids, family, work, all of that kind of stuff. We talk about it because really it does affect growing baby. We're not just looking at blood pressure numbers, and we're not just looking at, how your fundal height, like
I
we're
wish I would have gone to
incorporating.
you. I'm like upset. I
Hey,
need
there's no
another
chance,
child.
right?
No, there's actually not another chance.
There might be.
But if I come the next Mary, I'll call you.
Anything can happen. But
Only 99.7% effective.
I
There
know.
you go.
Michael didn't go get his checkup appointment.
Uh-oh.
I think you did tell me that. Yeah.
Yeah,
there's
he
always
never
a chance.
did.
Well, but you know what? What was I listening to? Something I can't remember. Oh, yeah. I think it was somebody that came in to do a sneak peek. It was 11 years after.
Can you go over like the start to finish process? Like say
Of
somebody.
the care?
Yes.
Okay. Yeah. So when they come into their first prenatal appointment, we do go over like nutrition, just like different things that they can do. All right, so when they first come in, really one of the things I do encourage a lot of families is to interview the midwife, because really this is going to be where you have to have a good fit, okay? Because you end up building a relationship, and I don't know, I think I did mention it a little bit earlier, like you build a relationship, so like I've developed some longtime friends, just from midwifery care, from me being their provider, but you really need to have a good fit because this is somebody that's going to walk with your journey for this birth, okay?
Yeah.
But for the first visit, once you agree, like, okay, this is who I want to hire as a midwife, and that's what you're doing. You're hiring your provider. You are our clients. It's not where I tell you what to do. Like, I may encourage you and recommend, and all of that kind of stuff, but it's still your family, your baby, and you get to make the decisions that you want for your family. So your provider, your practitioner, your doctor, you hire them. Okay. So once you hire your midwife for the first prenatal visit, then we do go over education. We go over a health history. We do, so the education is the nutrition. The health history, we do labs to make sure that you are healthy, And for the most part, if you haven't been diagnosed with anything major, you're not taking, certain medications for certain disorders already, then for the most part, you're still going to stay healthy, After that, during all of the prenatal visits, then that we're just making sure that you are staying healthy, that, different things aren't coming up, because there are situations that can come up that can, like I said, put you at a higher level of risk, so, gestational diabetes, hypertension, preeclampsia, those kind of things. Like, we definitely want to make sure that those things aren't popping up. Okay.
I'll let you continue, but say somebody does have an issue like that pop up, would you personally still deal with their care, or would you refer them to a doctor?
So it would depend what it is. So
Okay.
if it's like gestational diabetes, that can easily be corrected with diet and exercise. And as long as you can maintain it with diet and exercise, then you can continue to have an out-of-hospital birth. Because that's the biggest thing too. It's like you want it to be safe for mama and baby, okay? So there are certain times when that's just not the case anymore, and delivering in the hospital is safer than delivering outside of the hospital.
Okay.
Yeah.
So like preeclampsia, that one, they would have to go get
Mhm.
care from a doctor?
Yeah.
Okay.
And in that situation, then we would transfer, and depending on how far along you are in the pregnancy, sometimes it could just be where like, hey, your due date is tomorrow, and now you develop preeclampsia, let's just go into the hospital and have a baby, But if you're like 28 weeks, then it's like, oh, okay, let's send you into the doctor, and then they can follow you, until it's a good time to get baby earthside.
Do you still stay with them in the process? If something like that happens, is it?
Kind of.
Okay.
I mean, it's not like a formal where I would be in charge of their care anymore. At that point, it's the doctor who's going to be taking care of them. Unfortunately, here in Amarillo, there's not a very good, once a lot of the doctors kind of don't want to be associated with the midwives.
Oh, okay.
I hate that I would have to say that, but there's they kind of want to take care of the mama, which I get, but kind of, I still keep up with them and, hey, how's it, how are you doing? Do you need anything? Do you have any questions? Because sadly, when you do go to the doctor's office, you don't get all of the education. It's not because they don't want to educate you, it's just they don't have the time. It's just like quick, you have to get in, you have to get out, they have to see so many patients, so the doctors don't have the time to educate you. So in that situation, I would still, call them and keep in touch. And then if they're wanting to continue their postpartum care afterwards, then we're able to do it just depending on what the situation is. Because sometimes if it's still something where it's like, yeah, you were really high risk, like you still need to stay under the care of a doctor, then, they would stay under the care of a doctor for postpartum as well.
Okay. So say everything, I didn't mean to cut you off, but I think, people might have some questions there. Say everything is going well in the process. What do you do after? Like things are going good in the pregnancy, you're seeing them. What's next in the process?
Then we have a baby.
Then we have a baby. How does that go?
So with the baby, really, baby gets to choose their own birth date. That's just it. We do have an estimated due date, but that's what it is. It's an estimated due date. It's not an eviction date. And sadly, we're in a culture where we kind of want to know, we want to be in control of certain days. We want baby to hurry up and get here. And this is God's ultimate test of patience for parents, because it's whenever baby's ready to come. So when mom goes into labor, then they just call me and I head over either to their house or the birth center, and then we labor. We do monitor during labor as well. We have a baby. We make sure that baby's transitioning well from inside life to outside life. We make sure that mom is doing okay, bleeding is good, all of that stuff. We probably end up staying either at the home or the birth center for about 3 hours after the baby is born. We assess the baby, and then we assess the baby, weigh the baby, do all the measurements, all of that stuff, get baby onto the breast. We do a lot of support with breastfeeding as well, and then we go home.
So, say somebody was a little bit afraid to have baby at the house. What kind of care do you offer at your birth center?
So really, I tell everybody it's your home versus my home.
Oh, okay.
Kind of the thing, okay?
Okay.
Because everything that I have at the birth center, I'm going to have at home.
Oh,
So,
okay.
Yeah, so there's not going to be any differences. It is an unmedicated birth, okay? It's unmedicated, but it's not where we don't do anything to help with the birth or to help with the discomfort of labor. Because there's water that we can use, counter pressure, just breathing, positioning, warmth, cold, music, so it's like we use all of the senses to cope with it.
Oh.
So, and labor can be intense. It can, but it's so much bearable when you're able to do what your body's telling you to do.
Yeah. Do you have doulas that work with you?
Yeah. So actually, like in my practice, I have like my standard package, and it does come with a doula and childbirth education classes as well.
Okay. Can you go over some of the techniques? Because I wish I would have had these.
So like for coping mechanisms?
Yes.
So water is a really big one because you just have that, and it's probably like that counter pressure that you're getting from the water, that kind of just relieves some of that discomfort, okay? Also like hip squeezes can help. Some moms like it, some moms don't like it. Doing lower back counter pressure, so just on the lower back, that can also help. There's 2 different areas that you can do. You can go like right on the side of your tailbone and kind of just push on that. Actually, you can even do, they're called like saline, I can't remember right now, but you can inject like 4, they're not dots. I mean, they end up being like dots,
Yeah.
But you inject saline in 4 different places, and it's just like acupressure.
Oh, okay.
So I don't know
Is
what
that
those
good for
nerves
back
are.
labor? 'Cause
Yes.
I had horrible back labor
Yes.
with both of them, and I swear it's worse than regular labor.
Mhm.
So you can do that for that?
You
Okay.
can. I haven't done those. I've only done them once when I was in school, and I think from that experience, it seemed to hurt the mom more to actually do the injections than it did to help mom. But it's out there. That's something that can be done. It's something that can be done, but it's just that counter pressure where it's like acupuncture, like I said. And then you can even kind of help with the tailbone by actually pressing on the tailbone. So it's just going to be different for every mom. Let's see what else. Really, it's just the focusing also. Whenever the wave starts to come or the contraction starts to come, where you just like really zone in to like kind of stay on top of it. Okay. And then just the different movements. So I'm a big believer that you are going to get your body in the position that it needs to get to cope with the intensity of labor.
Yeah.
So, and it's pretty hard to do that when you're strapped down to a bed,
Yeah.
and you can barely move, because if you move a certain way, then they can't pick up the baby, and then they want you to stay a certain way. So
Just buy a little squeezy dinosaur.
Yeah, Julie had to squeeze.
Well, because my water broke. I was at Sonic and after my son's baseball practice. My water broke in the drive-through. So I was like, well, okay, I guess I should go home. So I call my midwife. I was like, my water just broke. She was like, okay, I'm on my way. Call my husband. He was 2 weeks early. And so I'm a procrastinator. I had nothing. She gave me this list of things to get, and I didn't get any of them. So I was like, you need to go to Walmart and get all this stuff because I'm going to need it.
Mm-hmm.
Well, so I'm there at home, and all of a sudden it's getting worse. And I was like, this is the dumbest thing I have ever done. I cannot, because at this point it had been like 15 minutes since my water broke. And I was like, I cannot do this for like 6 more hours. I cannot.
Mm-hmm.
And so I like hobble my way. I'm like gripping the walls, you know, trying to like make it to the living room. And I was like, they can't find me on the toilet. I have to make it to the living room. And so I make it, and I shove the couch out of the way, and I had a towel between my legs. And I shoved the couch out of the way. And then there was, my son had one of those little dinosaurs toys where the eyes kind of bug out when you squeeze it.
Mm-hmm.
I just grabbed it, I was like squeezing it. And I was like, okay, whoever gets here first, whether it's the midwife or my husband, they're gonna take me to the hospital because I cannot do this. And then all of a sudden, this is like maybe a little over 30 minutes since my water broke. And then my body, it was like, I need to push. And I was like, this can't be happening already. Like, it's been 30 minutes. And so I barely managed to dial the midwife. And I was like, I feel like I have to push. She's like, don't push, I'm at the edge of your driveway. I was like, I can't. And so she comes in, she like busts through the door. And my husband's like right behind her, and they like bust in. Dying, you know, like, and so she like checks me, and she was like, he's coming, he's right here. From the time my water broke to the time I had him was under an hour. It was insane.
Yeah, sometimes it can be fast and furious.
Yeah,
like that.
so, I mean, yeah. I was very glad she got there when she did, but I almost just did it by myself. Your body knows what it's doing.
Your body was made.
Do you find, like, doing it naturally that people tend to have babies quicker and sooner?
It kind of just depends still. You know, I mean, a lot of times when your water breaks, like, it could be a lot more intense because those contractions are more intense. That's why whenever you go into the hospital and you're, you know, laboring, the doctor comes in and says, I'm going to go ahead and break your water. That's going to speed things up. You know, so it could speed it up. But I mean, I've seen anything to where, you know, labor starts. A lot of times the early labor is what can be really hard because a lot of moms are really excited that, oh, hey, I'm finally in labor. I'm going to get to meet this baby. But like 24 hours later, they're still having contractions. They're not really intense contractions, but they're there that it's enough that they can't get good sleep.
Yeah.
You know, and then the intense ones start, you know, and then they're like really tired, you know, so it can just be anywhere, or it can be your water breaks and we have a baby in 30 minutes.
Yeah, it
you
was
know?
so crazy. Because I remember, like, they were so, like, strong. And I was like, I don't know how women do this for hours. Like, I can't.
I don't think
But it was those last one. I mean, he just came so fast.
Like this, you know, me being the foolish one in the beginning, I started having contractions, and I thought they were just like Braxton Hicks, and I had never had them before. It turns out they were real. And I remember my water broke, and I sat there and I was feeling them. I was like, so this is what this is? I was like, wow, I could do this all day. And then it's like 15 minutes later, because I had peak really quick too. It was like in an hour. He came really, really fast.
After your water broke?
Yeah, and I had a hospital birth, but I planned on getting the epidural, and I missed the line. And I just remember begging my mom. I was like, tell them to do it! And she was like, it's not gonna happen. And I remember like waiting for the doctors, and it's like you said, your body knows what to do, and they kept telling me to hold on. And by holding on, I was throwing up because I couldn't. I wanted to push so bad, but they said hold on until they're all, and it was like 10 people that I didn't know. Because they asked me if random doctors could come in, and I didn't care. So to send them all in. So there's like 15 people lined up. experience and go with somebody that can do it more natural. And you know, I can definitely see the benefits now that it's all said and done.
Yeah.
It's just a much more, it was just so much more, I'd say relaxing. It's not a relaxing experience, but like the after giving birth, it's just so nice to be in your home.
That is,
to just be where you're comfortable.
yes, that is one of, so honestly from birth center and home birth, I do prefer home birth.
Oh, okay.
And one of the main reasons is because the laboring, birthing mama doesn't have to go anywhere, you know? No matter what, I have to leave my house is what I tell everybody. I was like, I have to leave my house either to go to your house or to go to the birth center, you know? So no matter what, I'm leaving. You know, but the birthing mom doesn't. You know, she starts to labor at home or at Sonic, you know, but then goes home.
Well, when my husband was at a hockey thing, and I was like, can you bring me a tea on your way home too? And he was like, what? I was like, no, I didn't get to get my tea.
Yeah.
Sorry, what?
Yeah. So they start laboring, you know, we come to them, you know, baby delivers, then we recover mom, they stay home, they're not having to go anywhere. You know, so everything is there, you know. And one of the nice things too is like, you know, you can have other family member, like siblings there, you know, whereas unfortunately right now in the hospitals, you know, you're very limited to who you can have.
Yeah.
So that, you know, just involving the family as the siblings, you know, because sometimes too, when you have too big of a birthday party, you know, when you have a lot of people just watching you and staring at you, like some moms feel like they have to perform, you know, and mammals typically don't birth in front of a big audience, you know. So like if you look at any cat or dog that delivers, they typically kind of go off on their own, you know.
Well, that didn't happen.
No, not with 10 people staring at you.
At that point, it didn't matter. I could have had like a whole thing of random people I didn't know coming. They didn't have to be doctors. It was fine. Remember, I said I don't want anyone in there at all. And by the time it was all said and done, I was like, wow. So what is community-based birth?
So community-based birth is delivering outside of the hospital. So either a home birth or a birth center birth.
Oh, okay. I guess, is community-based birth safe?
It is. So like I was telling you earlier, you know, as long as everything is healthy for the mom. So if the pregnancy starts off healthy, the pregnancy ends off healthy, then having the baby outside of the hospital is a really safe option, okay? So hospitals are amazing. We need hospitals, okay? But one of the sad things about the hospitals is everybody is treated exactly the same. Okay, so you walk in from the person that's the lowest risk, you know, to the person that has more risks. They do the exact same thing. You get admitted, they start an IV, they put the babies on the monitor, or the baby on the monitor, you know, they want to, you know, start doing interventions. Okay, so you're laboring, but let's go ahead and break your water. Okay, well, your water's broken, but these contractions aren't coming fast enough. Let's give you Pitocin. You know, so that's like the domino effect of all the interventions that are happening, okay? And when everybody is put on that, you know, scale, or, you know, if everything is being done exactly the same to everybody, no matter what your risk is, then it puts you at a higher risk with everybody else. And that's why there's a 33% C-section rate. You know, did women really forget how to give birth?
Right.
You know, I mean, our bodies were made for this. So, I mean, it's just the things that are being done because they're medicalizing it. You know, we don't need all these machines. You know, they're nice to have when you need them, you know, for certain things that come up, you know, like if we do have certain conditions that we need to monitor baby really closely, then having continuous monitoring, that's a good thing, you know, but when everything's perfectly fine, you know, it's not really always beneficial to have it, you know. So with continuous fetal monitoring, okay, so that's when they put you on the monitors, all right, they're listening to baby. That was, I think it was back in the 70s that they started using that, and they invented it or started using it during labor, so like that it can decrease the risks of cerebral palsy, and it didn't do that. The only thing it did is increase the C-section rate, is what it did.
So you said the C-section rate at hospitals is roughly like 33%.
National.
How often does something like that happen with what you're doing? Like, how often do you actually run into a problem
Not very often. So
Okay.
when you let labor progress on its own, then, I mean, I haven't delivered thousands of babies, you know, but I've only had 4 mamas that have ended up in C-sections because something was going on, you know. So like we're listening to baby and then I'm like, yeah, I'm just not liking what I'm seeing, or you know, you've pushed for a while, or you know, there's not much progress, you know, kind of a thing. Then it's like, okay, let's go ahead and go into the hospital. We go into the hospital, they labor there for a while, and then it's like, okay, let's call a C-section. So, yeah.
So what kind of helpful advice could you give women, or some comforting words of wisdom, who are wanting to maybe go your route but are a little afraid?
Well, I mean, the main thing is just be educated. Okay, like really look into, you know, community-based birth, and really look into the hospital births, you know, look into like the different interventions that are being done. Definitely just ask questions, you know, you don't have to start with the midwife right away. You know, if you're already seeing a doctor, ask questions, you know, don't just assume because they're doing it, it's okay, you know. So like 36-week checks, vaginal, cervical checks to see how far you're dilated. What are they for? Why? You know, why do you need to check? 1, they're not comfortable, but 2, they're also not going to tell you anything, you know. So if you are, especially a second-time mom, you can be sitting at a 4 for 3 weeks, 4 centimeters for 3 weeks. You know, so why check? You know, I don't do any vaginal exams during prenatal visits unless mom asks me to, you know, because it's not going to change what I'm going to do. You know, I'm going to go to your house when you start having contractions and we're going to have a baby, you know, whether that's tomorrow or if that's next week. You know, so really just ask questions, you know, don't just assume that what's being done is okay. And then, and that's with the midwife too. You know, so like I was saying, you know, just because they didn't tell you about ROGAM, that doesn't make it right.
Right.
You know, so like for all my negative moms, I'm like, okay, this is what can happen if you're RH negative. This is what we have to prevent that. You know, these are the risks if you do get it. These are the risks if you don't get it. What do you feel comfortable with?
Right.
You know, so, but for out of hospital birth, to see if you want to go that way, there are a couple of documentaries that you can research and see to kind of just really feel comfortable. And that's another thing too, is where you need to feel comfortable and feel safe. You know, so if you don't feel safe having a baby outside of the hospital, then that's probably not right for you. You know, because sometimes the hospital is your safe spot. You know, but sometimes your hospital isn't the safe spot either. You know, there could be some trauma from previous deliveries, or there can be trauma from, you know, family members. You know, I mean, I've had anything where people are like, you know, I had a family member that passed away, and that's what I associate hospitals with.
Oh, okay.
You know, but just, I guess really just be educated, you know, and know. So,
what are some common misconceptions about using a midwife?
That no care is being done.
Right.
So, and that's the main thing. It's like, did you even get any prenatal care? Or so you're going with the midwife, you didn't have any care.
Yeah.
And that's not the case, you know. So in reality, you probably get more care because you have a lot more education.
Right.
Like I said, the visits are longer. So there's more that we talk about. So there's still the, you know, the regular routine visits. We're monitoring blood pressure, we're listening to baby, we're checking fundal height, you know, we do ultrasounds, you know, it's not like, oh, you don't do anything, you know. So that's the biggest misconception.
Right. And yeah, like when I used, I kind of had that same preconception before I used a midwife, but in the end, I felt very well cared for. Like it was a much more personal experience than with my oldest, which was at the hospital. And I mean, I had a good doctor. There was nothing wrong, but it was like I was just a number. In and out, had the baby, okay, you're fine, you know.
Well, and like I said, you know, in the visits we talk about lots of stuff. You know, like sometimes like I know family members, you know, it's like, oh, because they come in and they're like, oh, crazy Uncle Bob. He started doing this, and it's so like we just talk about stuff. So like we really build that relationship, so like when you actually go into labor, like I know you, I know your wishes, I know what you're wanting, you know. It's not just like, oh, first time meeting you kind of a thing, which sadly in the hospital sometimes that happens. You see this doctor your whole prenatal visits, and then you go in to deliver and it's whoever's on call.
Oh, that was me.
Yeah,
the second one. So.
Yeah. I was actually really blessed, even I didn't have midwifery. Well, I did have the midwife, but I didn't realize she was a midwife, but I was in the military, and it's just like you go in and then whoever, there at the hospital, attending, then that's who delivers your baby. With my first one I did, I didn't know who she was, but then when I went in for my second pregnancy, she saw me throughout my whole pregnancy. She's the one that delivered me. When I was pregnant with my daughter and my son here, the doctor that saw me through all my pregnancy delivered me. So I actually got pretty lucky. So I don't have any complaints about that. So
do you, just a random question, but a lot of people are really into finding out gender of the baby nowadays. Do you tell them? Can you tell them that?
Yeah.
Okay.
Yeah. So like we do genetic testing if they want to know as early, as 9 weeks. With genetic testing, there's also the sneak peek, the gender testing, which is available to anybody. But you can know as little as 6 weeks now with that one. When they go for their ultrasound, they can check if what baby's gender is. So it's not like where you're going with the midwife, you're not gonna know what your baby is.
Yeah, I had all that ultrasounds and all that stuff.
Yeah. What about testing for like Down syndrome?
The genetic testing?
Yes.
Yep. So that's still offered.
Okay. So
do you? Because with the midwife I use, she kind of like outsourced that stuff. Like she gave me like names and numbers of people that she used for that kind of stuff. Is that what you guys do, or do you have that in your facility?
So I draw all labs.
Okay.
I draw all labs. I don't do anything there. I send it over to the
You're
lab.
not the scientist.
Yes. I don't have all my machines in the back.
You're right.
So I draw all the labs, send them to wherever it is at. So like all the genetics are shipped out. So we just draw them, drop them in FedEx, and it gets out to the lab, and they do what they do, send back the report. Same thing with regular labs. Some send it out to the lab, and then they give me back the report, and we go over it.
Okay. So I just kind of wanted, everyone to know. I wasn't sure if people actually understood that they could get all of this stuff. I think most people think that they have to go to a doctor for that.
Some people do ask if they need to do concurrent care. So, and they don't. They don't, because everything that I'm going to do, or everything the OB does, is everything that I'm going to do as well.
Okay. How does the process, because you're the one, you're the go-to. How does the process work of, say they go into labor, and so people aren't worried you couldn't make it or something like that? Because I've personally seen you, we're out having dinner and you're like, I gotta go. So can you tell people a little bit about how that works, how you're prepared for all that?
So just like being on call all the time?
Yeah, because that would be a worry I personally would have, because you would be like the go-to person. What if something happened and you were in a situation you couldn't get to me, to have a baby? How could somebody feel comforted that?
So, one of the things I always ask all my mamas to do is kind of give me a heads up. Sometimes you can't, but if you're already starting to feel like, ooh, these are contractions and they're starting to come more regular, then I always like a heads up. So like that I could plan. So if we did have dinner dates, then I can be like, okay, either we take 2 separate cars or you're leaving one out.
I've literally seen Silvia do that.
Like that, I don't ruin the night for everybody, kind of a thing, but I'm still prepared for that in the situation, because babies do want to come whenever they want to come, it's on their schedule, not on our schedule. And so in a situation where there's 2 babies wanting to come at the same time, then I can call backup midwives.
Okay. Oh, okay. So you have that option too,
yes.
In case?
Yes. I haven't had where 2 babies came at the same time. I've had where they threatened to come at the same time, so all moms start laboring at the same time, but everybody takes their own turn.
Oh, okay. Yeah. So the most part, everything turns out pretty normal.
Yes.
And I've seen too where I think what you'll say, I have to be in town. Isn't it something like that? Within like a certain amount of weeks, you'll stay in town. It's something like that.
Well, so like whenever I have the moms in the window, because I mean, like,
Yeah.
there's times where babies, or you can, to safely deliver a baby outside of the hospital, it needs to be within a certain window, okay? So if a baby wants to come before 37 weeks, and that's what's called late preterm, and it really is gonna be safer for the baby to deliver in the hospital, because those babies, you don't know which way they can go. They can either act very prematurely and need all the assistance that a premature baby needs, or they can act like a full-term baby and not have any issues. But in that situation, you definitely want to be where baby needs to be at, you know, sadly, even though that's not what mom wants, you know. But we really need to be at where baby needs to be at. And then to deliver at the birth center, then you need to deliver by 42 weeks. For home births, you can go a little bit longer, or you can go longer. But like for the restrictions that the state puts on the birth center, it can't be anything after 42 weeks. So within that window, I'm always like, okay, I'm limited to what I can do during that window. You know, I mean, like I can still go like to see family in Dumas because I can get back fairly quickly, you know, but I probably can't go to Austin. Kind of a thing. So, but we can still go out to dinner.
Yes.
Because even though they're on that window, it doesn't mean they're gonna have a baby that day. So it doesn't mean I have to stay at home locked up, not doing anything. You know, kind of a thing. So, but
okay. Okay, and you also mentioned you do like after birth care,
yes.
right? Can you go into that a little more? Because it seems like a lot of moms struggle with that lately, you know, the nursing and, you know, making sure they feed their baby correctly. So unfortunately, like we kind of do leave moms to by their like normally, you know, to fend for themselves, you know. That works out better that way.
No, not really. I mean, you know, well, at least for like a Hispanic culture, you know, typically like mom or mother-in-law comes, your tias, your grandma, you know, all of that stuff, like they just come and help take care of you, you know. Typically, like you're not supposed to do anything for 40 days, you know. I'm kind of wish I can go back in time, you know, because that's, my mom had came to take care of me, and I was like, Mom, don't worry about it, you don't have to do that, you know. My aunt's like, you shouldn't be out this late, and I'm like, I'm fine, you know. And now I think back and I was like, man, I was so naive and dumb. I should have been like, yes, Mom, do all you want to do, and I just laid in bed for 40 days, you know.
That would have been nice.
You know, but unfortunately, in the United States, the culture is that we kind of just let women fend for themselves, you know, women fend for themselves. But for the care that I do, so immediate postpartum, I stay with them for probably about 3 hours. Now, if I'm needing to stay longer for whatever reason, you know, like I'm making sure bleeding is okay, baby hasn't latched on just yet, you know, or sometimes it's just like, I'm just not ready for you to leave. You know, kind of a thing, because oh my gosh, now I have to keep this in my life. Like you're trusting me with this baby. You know, so sometimes it can take a little bit longer, but then I go back and see them again, depending, you know, what time of day the baby was born, but like 24 to 48 hours afterwards. You know, I check on mom, make sure bleeding is okay, that they're doing okay emotionally. You know, I check on baby, make sure baby's still doing okay. We do screenings for the baby at that time. And then at 2 weeks, I see them again, same thing. We're checking on breastfeeding, we're checking baby's weight, we do some more screening for baby if they want to do the screening, checking for postpartum depression for mom.
I was going to ask you if you would handle something like that.
Yeah, we check on postpartum depression, and then again at 6 weeks. I see them again. And then of course, one of the nice things about midwifery care is that they have access to me 24 hours a day, 7 days a week. So if they do have any questions, they do have any concerns or anything like that, then they can just reach me.
Do you, say somebody has postpartum depression, what's the protocol that you would use?
So really, it's going to be different for everybody, you know.
I'm huge on it because I had a really bad hormonal experience while I was pregnant, and my sister.
I had postpartum depression.
And
really bad.
it's not what people think it is.
Yeah.
It is.
The darkness.
We call it the darkness because it really is something really serious.
Yeah.
Yes.
And so I really want to get across that you would help people with that if they feel ways they don't think that they should feel. You know, it's really scary. So
definitely. Well, one of the main things that I would definitely, and first and foremost, I always encourage is counseling. You know, because it's really beneficial for counseling. And then if we need to, we can add medication. It's not for everybody, you know, counseling isn't for everybody, medication isn't for everybody, so it's gonna be very individualized, you know. I especially, if I have moms, and the thing too is like sometimes, and I think it's getting better now, but there for the longest time, it's like, oh my gosh, if I have postpartum depression, like I'm a bad mom, you know, like I shouldn't have this, you know, and it's just not where and I don't know if it's just because it's, I don't want to say stereotypical, but misconceived of what it actually is, you know, because it is a hormone imbalance is what it is. And sometimes it can be very short-lived, and sometimes it can last a lot longer. And if it's not addressed, then that's when you have the dangers of it lasting a lot longer, a lot longer. And then it's not just going to affect mom, but it's going to affect babies. Because if you can't take care of you, then you can't take care of babies. And then everybody's gonna end up suffering.
Yeah, and like to talk a little bit about that, you know, it, again, we think postpartum depression or prenatal depression is one thing, but it can come in like all different forms. So like for me, it was like weird intrusive thoughts, like panic attacks, anxiety attacks. It was like depersonalization to where I didn't even feel like I was real anymore. It was like really weird stuff. And I mean, you saw me go through that. And like for you, what was it like for you?
Mine focused on the baby. I was convinced that if I slept, he would die. So I wouldn't sleep. Yes, it was horrible. So one time I didn't sleep for 3 days because I couldn't. Because I was convinced if I fell asleep that he was gonna die in his sleep. And I finally, I was like, I can't do this. Like,
I remember you called me, and you're like, I'm doing all this stuff. Like, I had to move into another room. I can only watch certain shows. And I was like, this is where it starts. Because for me, it started, I had to, remember I could only watch NBA basketball. I know that sounds really weird, but anything else gave me a panic attack. And so I would only watch like NBA basketball every day. And you were telling me I can only watch this certain show. I was like, I think it's time.
Yeah, and well, because I was concerned about, you know, taking medication while breastfeeding. And like, we have a really good counselor that we both use that I saw, and she was like, you know, there are these studies that, you know, this medication, it doesn't pass through the breast milk, and she was like, I would consider trying some of that because it's better than what you're doing now.
Yes.
And so I did end up having to take some medication for like a month or two while my hormones balanced out. But it was hard, and so I'm glad that you talked to the moms about that.
And that's what I tell some of my moms too, because of course this is going to be more natural-minded people that want to do it this way, where they don't want to do medications, you know, or very little of it, you know, during pregnancy or after pregnancy, you know. But one of the main things that you need to consider too is like the risk benefits. Okay, so most of your antidepressant medications are safe during breastfeeding, you know, and if something does
I had to take it, so.
And even during pregnancy too, a lot of them are safe during pregnancy. If you're needing to take it while you're nursing, very little gets through the breast milk. If it does, that by the time it's actually metabolized from the baby, there's like nothing in the baby's bloodstream. You know, but that's, you know, you have to make sure that you do the correct ones, because there are some that could, you know, cause some potential effects to baby. But that's the big thing is, I tell some of my moms is like, because they're like, I really don't want to be on medication. And it's like, I get it, you know, but if you can't take care of you, then you're still not taking care of baby. So then it's still not good for baby. You know, and they're like, oh, okay. You know.
Well, it is, I don't know, there's such a stigma behind it. Like if you take medication, then you're crazy. Or if you're the mom that's not doing well, then you're a bad mom. And like, you know, for me, I was experiencing so many weird, bad symptoms. I would even go online, and it was hard to find anybody that even wanted to talk about it because it was so scandalous, you know. And so I'm really glad that you work with moms in that aspect.
Yeah, because it's something that needs to be addressed, you know, and when it's not, like I said, it can last a lot longer, and then it's going to be worse. And then it's going to be worse, so.
And what about again, I'm in the mama tribe, so I see all these questions. A lot of moms get really fearful about nursing and feeding their baby properly. Like, do you help with any of that, like helping like baby to be able to latch on? And
Yes.
Okay.
So I do provide breastfeeding support, but I'm not a lactation consultant either.
yes,
So sometimes we do have to call in the pros. I tell everybody, I was like, I'm good at like, yeah, that looks like a good latch, or no, let's reposition baby like this or like this. I'm like, but when it comes to like trying to get a sleepy baby to wake up, I'm like, I'm not that great at that. I tell everybody that, so one of the other midwives that just graduated, her name is April, and I tell everybody, I was like, if that's the issue that we have, I said, April can get a rock to latch on, so like, let's call it.
That's funny.
So it kind of just depends, and then of course, we're seeing a lot more babies that have tongue ties or lip ties or cheek ties. Like, I didn't even know there was a cheek tie. This is like something newer that I knew like within the last couple of years, that can have cheek ties. So if we're thinking that it could be something like that, so we're like, well, it looks like the latch is good, but mom still has painful nursing, or is having trauma to the nipples, or baby's not gaining weight, or just having all of these other symptoms, then we're like, okay, I think it's time to call like somebody that, can look into these ties.
I think our aunt does that, Aunt Christy. It's like, I'll have to look it up, but she works with babies and stuff with those ties and stuff to get them to eat right, and she can even make, I saw her with a picture of a little girl whose chin was back, and she worked with her and it came forward. So.
She does like, is it cranial sacral therapy, or is
It's
she like
myro, I don't know, I'll have to look it up, but I guess you can actually work with people like without having, or babies and kids without having to go the surgical route with that kind of stuff.
There is. So I mean, even like chiropractic care can help with nursing and ties and all of that stuff. Stretches can help. So like if you have, especially like a speech therapist, and they can help stretch those things out. But it's not very common. It's something that's newer. For like speech therapy to do something like that. But it's out there. It's definitely out there. And hopefully it starts to become more popular here in Amarillo, because it is something that's definitely needed. And then the very severe cases probably definitely need some kind of revision.
Okay.
So, but that doesn't mean everybody needs revision.
Right.
Okay. So we've covered a lot. So what do you want the listeners to take away from watching this?
Wow.
Some key things.
So I guess one of them is that if you have a healthy pregnancy, then you don't have to go to the hospital to deliver. Now, of course, it's what everybody wants, because not everybody wants an unmedicated birth either. So if you definitely want an unmedicated birth, and you have a healthy pregnancy, then having a baby outside of the hospital is a very safe option. Also, by going into the hospital, know that already increases your risks for a C-section, especially if you're being induced, because that just is the start of the cascade of interventions. Doesn't mean that you will end up with a C-section. I had all my babies before I knew, I tell everybody before I knew better, before I was a midwife, and I was induced with all of my boys. And I ended up having vaginal deliveries. Everything was perfectly fine. I didn't have any issues. I did have the cascade of interventions, but I didn't have any issues with my delivery. So it doesn't mean just because you get induced that you're gonna have a C-section, but it does increase the risk. Another thing is wait for baby to be born. Unless it's absolutely medically needed for the baby to come, then just tell your doctors, no, I don't want to be induced. This baby's going to choose their birth date, because when you do that, then it decreases the risks of them intervening.
So why do they want to induce so many babies? Is it just like time constrictions in the hospital?
Not necessarily time constrictions from the hospital, but probably the provider. Oh, I'm going out of town. It's Christmas tomorrow. Those kind of things. Do you want to hurry up and meet your baby? And of course, at that time, you do. You're miserable.
Get out.
You can't sleep. This baby's invading your insides. The end of pregnancy isn't very comfortable. And at that point, you're like, okay, I waited long enough. Yeah, let's go ahead and have a baby. So but that does increase the risk of things that you don't need happen will happen. Also, the sooner you get to the hospital, the more risk there is for interventions because you're there. They can't just keep you there, you know, like they want to do something. You're in a room, they want to do something for you, you know, so it's like, well, let me check you every 2 hours and see what you're doing.
I feel like I went in there and they're like, ugh, another one that's not ready that we're gonna have to turn away. That thinks they're ready. I'm pretty sure that's what they think, because so many moms go in there and they're like, oh, we're ready, and they're like, you're like a 1 and you're like not anything at all.
Yeah, so it would be like laboring at home, and not necessarily, you know, sometimes moms can go really quick from 1 to complete. It happens, you know, but if it doesn't, then that's when interventions start, you know. That early, they're not going to keep you.
Yeah.
You know, they'll be like, you just go home, you know, try to get some rest, you know, kind of a thing. But if you go in at a 4, out of 5, you know, and you sit there for a while, and they're like, okay, well, you're a 5 now. You went from a 4 to a 5. Like, let's go ahead and get this thing going. Let's give you Pitocin. Let's break your water. Let's, you know, do this. Let's do that. And here's the thing too. Every time somebody goes into the room, you risk delaying contractions. Okay, so like if you think about it, we're mammals, and like, let me go back to the cat. If your cat is laboring and somebody comes in and starts to watch them, they stop contracting. So subconsciously, that's what we do too. We stop contracting until our body says, oh yeah, it's still safe to continue, you know? So when I worked labor and delivery, moms would come in and they'd be like, yeah, I'm contracting every 5 minutes. And we're like, okay, we put them on the monitors and nothing. And they're like, I promise, I was contracting. And I'm like, it's okay. You just give them a little time, you know, and then you see those contractions coming up. It's because they went to a new place, you know, so your body's like, hey, am I okay to have a baby? You know, you're not going to want to have a baby if you have, this is what one of my instructors always said, you're not going to want to have a baby if you have a saber-toothed tiger chasing you.
Yeah.
Okay. And when your body releases cortisol, it doesn't know if it's, you know, good or bad. It's cortisol, you know, it's stress. Stress is stress, whether it's good or bad. Your body doesn't know the difference between them. So your body's going to be like, am I okay to continue? Can we actually have a baby? You know? Can we actually have a baby? So when you have the nurses coming in, seeing if you're okay and if you're ready for an epidural, if you have the doctors coming in because the nurse just came in, but wants to go ahead and check themselves, you know, how everything is going. And then you have the baby nurse coming in and having you sign other things. And then you have, you know, anesthesia coming in so they can do your consent. Then that's just going to prolong labor. It can. I mean, sometimes it doesn't matter. Sometimes you're going to go in and you're going to push a baby out no matter what because you're already really close, you know, but when the earlier you go in, then the longer the progress can be. So that would be something is if you're having a hospital birth, then try to labor at home as much as possible.
Okay.
So,
anything else you want to leave the listeners?
I don't know. I think that's it. I said a lot.
No, you said a lot of really good information. Okay, so what were your businesses again? Blue Haven and
Birth Haven.
Birth Haven
And Beyond Birth Midwifery.
Okay, so you guys check out Silvia. She's a really wonderful person. I've known her a long time. You're in really good hands with her. If you have any questions, or where could they go to find information?
So I do have a Facebook, and it's, my gosh, I don't know what it's called.
We will link it for you.
Yeah.
Yeah.
I think it's Breastfeeding Amarillo. Oh my gosh, no, I don't know. Because I set it up a long time ago. And it's kind of like, you know, you don't know your own phone number. Kind of a thing.
And whenever you think about it hard, like it just keeps not coming to you.
And so I do have that Facebook page. I also, I do have Instagram too, but I don't know how to work Instagram.
So we'll link
everything. And then my website is Beyond Birth Midwifery.
Okay.
That one I do know. BeyondBirthMidwifery.com.
Okay. So you guys, if you're interested in midwifery, check out Silvia, and we'll link everything below. Anything else?
I don't think so, guys.
All right. Thank you.
Bye.
Bye.